Maybe you've felt it. Your heart seems to skip a beat, or it seems like it's racing for no reason. That's a heart palpitation, and many times it's harmless, but for some people, it can be a warning sign. Joining us now to discuss is Dr. Mohamed Elshazly from the Orlando Health Heart and Vascular Institute. Thanks for being with us again today.
Thank you for having me.
Okay, so there are many types of heart palpitations. How do we know this one doesn't mean anything? This one might be serious.
Of course. So palpitations are one of the most common things we see in our clinics every day, and I like to kind of put them in two buckets. So the first bucket is a group of diseases where there's abnormal circuits in the heart or areas of abnormal activity, and these all fall within that bucket. So this includes things like SVTs, so these are supraventricular tachycardias. The most common of them is AFib, for example, atrial fibrillation, but there are other forms of it, okay? That includes things like, atrial tachycardia or atrial flutter. And then there are more dangerous ones which come from abnormal circuits in the lower chambers of the heart called the ventricles, and these are called ventricular tachycardias. Now there's a second bucket of diseases where the heart is completely normal structurally and the electrical system is normal, but it tends to respond in an abnormal way to certain triggers. Okay, so this falls, again, one of the things that fall within category is something called dysautonomias. So like POTS, it's one of the most common things that we see young patients for, where when they change position, their heart races. And other things like thyroid disease can sometimes cause palpitations, anxiety can sometimes cause palpitations, and these are the things that I kind of think about within that category. And then the last thing is there are some patients where we look at their hearts and do monitors and so on, and we don't necessarily see their heart racing, but they feel the palpitations. And some of these are sometimes called phantom palpitations. So for example, when people have very high blood pressures, they feel like their heart is squeezing, but they sometimes mistake it as palpitation.
Okay, let's talk a little bit about the thyroid connection, because when you think about my heart doesn't feel right, people, I think, assume there's something mechanically wrong with it, but that's actually not related to your heart at all.
Yep, exactly. The heart is completely normal, but again, the heart has it's connected to the nervous system, it's connected to body hormones, so it tends to respond to these things. So people with thyroid disease who have high levels of thyroid, it can cause the heart to race.
So as a general rule of thumb, if you're experiencing this on sort of a continuous basis and maybe you don't have high blood pressure or any of the other warning signs, you probably just need to go see a doctor.
That's correct. That's correct.
It's another reason to choose well with Orlando Health. If you would like more information, you can visit orlandohealth.com/heart.